My name is Cathy Scheepers, and I am the Region Head for Africa and the Middle East at the Max Foundation. I was born and raised in Pretoria. I've been with the Max Foundation for 15 years, and I've been able to travel all over the continent, meeting people living with cancer and healthcare professionals providing treatment. Behind the camera is videographer Martin de Bruin, who lives in Cape Town, also South Africa. He's been working with us for 13 years, traveling with the Max team and documenting our journey. Join me on this short review of our recent site visit to Tanzania, home to over 66 million people across 120 distinct ethnic groups. In many ways, Tanzania is a launch pad for the Max Foundation in Africa. Over 12 years ago, it became the birthplace of the Africa Chronic Myeloid Leukemia, or CML Patient Network, known as CML Life Africa, when Max facilitated a historic gathering of leaders from across the continent in Dar es Salaam. It was also the first country where treatment and care were decentralized under the Max Access Solutions model. On this trip, I was glad to be joined by my colleague Michael Rigglesworth, our VP of Program Operations. After several hours, and in Michael's case, days of travel, we arrived at Moshi early Tuesday morning at the Kilimanjaro Christian Medical Center, at the foot of its iconic namesake. A meeting helped us explore and reflect on the journey, friendships, and profound impact of this partnership over the years.
There's a growing trust from the community and the patients in this hospital. Before this, they had either to stay in the country and travel to Dar es Salaam, or if they had enough money, they can go to India, Kenya, or even to the US or to Europe. But we see more and more patients have trust in this hospital, and they even stay here, even if they could afford to go abroad. And the Max program has contributed to that a lot, because we are offering really high standard hematology diagnostics. We started with a microscope and our eyes in morphology. We are now offering flow cytometry, PCR. We even have done some karyotyping with the help of outside laboratories. So I think in terms of diagnostic capacities, we are really doing great.
It quickly became clear that the relationship between Max and KCMC had grown far beyond the patient care. It had left a lasting impact on physicians and healthcare workers, their hard work transforming how patients are diagnosed and treated through the availability of life-saving medications.
As a doctor, the greatest gift you can actually give your patient is the assurance that, look, we're going to get through this together. And the reason if there is medication. And it's not only medication, it's medication for free. So I normally tell patients that, look, you don't have a reason of not taking your medication, because for some of our patients, finances are always an issue. But, sometimes you're saying, in Africa, bumpy road is what we are used to this. But ultimately, you will reach your destination. And in this case, destination is someone who is at least leukemia free. They will take their medication for quite some time, but they will be disease free.
With its rich history, Ocean Road has been home to Max Foundation programs since 2012, the country's oldest healthcare facility established in 1895, and currently provides access to treatment for nearly 600 patients. Cancer is often a word associated with loss and fear. However, surrounded by determined young physicians and patients full of life and stories to tell, one cannot help but feel hope and excitement about the future and the potential to reach even more people.
And when I come to Ocean Road, I have a need to live more in order to support patients. And as long as my patients, they are happy as you see them, very supportive to each other. So give me more power of taking care of them.
So many important conversations, all in such a short time. We are once again reminded of the urgent need to reach more patients faster.
Tanzania is a testament to what we can achieve breakthrough partnership, because we could do all this work to get the drug here, but it really wouldn't be as impactful if it were not for our physicians being dedicated to understanding their patients, and those patients then in turn advocating for other patients. So this is really a team effort here, and it's amazing to see that in practice.
We are deeply grateful to each of our country partners who have stepped up and joined us in this mission to change lives and reshape systems. It is through this collaboration and commitment that patients in Tanzania are able to access the treatment and support they deserve.